Blood glucose level. Upon admission to hospital, it is very common to have your blood glucose level checked. Blood glucose testing provides useful information for diabetes management. It can help you monitor the effect of diabetes medications on blood sugar levels, identify blood sugar levels that are high or low, track your progress in reaching your overall treatment goals, learn how diet and exercise affect blood sugar levels, understand how other factors such as illness or stress affect blood sugar levels. Blood glucose levels are the amount of glucose that someone has in their blood at any given time. Having high or low blood sugar levels could indicate an underlying health condition that may require medical attention. Use an overview of normal blood glucose levels to understand what blood sugar levels mean. Get professional advice from a healthcare provider like an endocrinologist is the best way to learn more about whether blood sugar levels are where they should be. Not getting proper treatment for low or high blood sugar levels can be serious and lead to health complications, especially for those with diabetes. Diabetes complications include nerve damage, kidney disease, heart disease, or heart attacks. If you see a healthcare provider about your blood sugar levels, be prepared to answer questions about risk factors like what you eat, how much you exercise, and about your family history. Some healthcare providers may want to take a blood sample to test your blood sugar levels. Blood sugar testing requires the use of a blood sugar meter. The meter measures the amount of sugar in a small sample of blood, usually from your fingertip, that you place on a disposable test strip. Even if you use a blood meter, you'll still need a blood sugar meter to calibrate your glucose device daily. Your doctor or diabetes educator can recommend an appropriate device for you. He or she can also help you learn how to use your meter. Follow the instructions that come with your blood sugar meter. In general, here's how the process works. Wash and dry your hands well. Food and other substances can give you an inaccurate reading. Insert a test strip into your meter. Prick the side of your fingertip with the needle, lancet provided with your test kit. Touch and hold the edge of the test strip to the drop of blood. The meter will display your blood sugar level on a screen after a few seconds. Some meters can test blood taken from an alternate site, such as the forearm or palm, but these readings may not be as accurate as readings from the fingertips, especially after a meal or during exercise when the blood sugar levels change more frequently. Alternate sites aren't recommended for use in calibrating continuous glucose monitors. Talk with your doctor about how often you need to record your blood sugar results. The readings given by many devices can now be downloaded to a computer. If you manually log your results, record the date, time, test results, medication and dose, diet and exercise information. Bring your record of results with you to your doctor's appointments. Talk to your doctor about what steps to take if you get results that don't fall within the range of your target goals. Blood sugar meters need to be used and maintained properly. Follow these tips to ensure proper usage. Check the user's guide for your device for instructions. Use a blood sample size as directed in the user's guide. Only use test strips designed for your meter. Store test strips as directed. Don't use expired test strips. Clean the device and run quality control checks as directed. Bring the meter to your doctor's appointments to address any questions and to show how to use your meter. What are normal blood glucose levels in healthy individuals? Blood sugar levels can either be normal, high, or low, depending on how much glucose someone has in their bloodstream. Glucose is a simple sugar that's present in the bloodstream at all times. Normal blood glucose levels can be measured when someone fasts, eats, or after they've eaten. A normal blood glucose level for adults without diabetes who haven't eaten for at least 8 hours is less than 100 milligrams per deciliter. A normal blood glucose level for adults without diabetes 2 hours after eating is 90 to 110 milligrams per deciliter. Many factors affect blood sugar levels throughout the day. Type of food consumed, how much and when, physical activity, medications, medical conditions, age, stress, dehydration, illness, menstrual periods, alcohol. An ideal blood sugar level for anyone without diabetes or prediabetes, regardless of age, in the morning should be less than 100 milligrams per deciliter. Remember, blood sugar levels can fluctuate throughout the day as a result of the factors previously mentioned. Hypoglycemia happens when blood glucose levels drop too low. Low blood sugar can be caused by many things, including the 2 different types of diabetes, certain medications, alcohol, endocrine disorders, eating disorders, pregnancy, gestational diabetes, and disorders of the liver, kidneys, or heart. Some of the most common symptoms that someone with low blood sugar might experience are lightheadedness, dizziness, confusion, irritability, shakiness, nervousness, anxiety, chills, sweating, clamminess, having a fast heart rate, pale skin, hunger, sleepiness, fainting, tingling lips. If your blood sugar is low, you might start to feel some of the first signs of hypoglycemia, like dizziness, lightheadedness, or sweating. The only way to know for sure if your blood sugar is low is to test it with a glucose meter or other glucose monitoring devices. Hyperglycemia is the medical term for high blood sugar. Hyperglycemia happens when the body doesn't have enough insulin or when it can't use insulin correctly. Many things can cause high blood glucose levels, like type 1 diabetes, type 2 diabetes, stress, illness, or the dawn phenomenon. If you have hyperglycemia or suspect you may have it, talking with a healthcare provider is always a good idea. Some of the most common symptoms that may indicate hyperglycemia include fatigue, frequent urination, headaches, blurred vision, difficulty concentrating, increased thirst, weight loss. Untreated hyperglycemia can lead to a condition called ketoacidosis, and that is where the body creates waste products called ketones that can build up in the blood and become life-threatening. Symptoms include abdominal pain, presence of ketones, vomiting, exhaustion. You should seek medical attention if your blood sugar reaches 400 milligrams per deciliter or higher. Some lifestyle changes and medical treatments that can help treat hyperglycemia include eating whole, low-sugar foods that are minimally processed to keep the amount of glucose in the body at a lower level. Only exercise if there are no ketones present in the bloodstream. You can check if you have ketones with a urine test or blood glucose meter. Drink lots of water to help your body get rid of sugar in your urine. Adjust your insulin. Take medications as per your healthcare provider's recommendations. So blood glucose meters are easy to use. It depends on the design interface, but some glucose monitors are definitely easier to use than others. Most blood glucose meters will provide results in 5 seconds. Some manufacturers have made audible blood glucose monitors that give verbal instructions and verbal test results for their user. This range includes meters that can speak in other languages besides English.